The best way to safely remove blood clots in the body depends on the location and severity of the clot. Here are some general tips. Anticoagulant medication. Surgery. Exercise. Compression stockings. Seek medical attention. Anticoagulant medication is commonly used to treat and prevent blood clots. Here are some tips for safely removing blood clots in the body using anticoagulant medication. Follow your doctor's instructions. It is important to follow your doctor's instructions regarding the dosage and duration of your anticoagulant medication. Do not stop taking the medication without consulting your doctor. Be aware of potential side effects. Anticoagulant medication can increase the risk of bleeding, so it is important to be aware of potential side effects and seek medical attention if you experience any unusual bleeding. Avoid certain medications and supplements. Some medications and supplements can interfere with anticoagulant medication, so it is important to inform your doctor of all medications and supplements you are taking. Monitor your INR levels. INR, International Normalized Ratio, is a blood test that measures the effectiveness of anticoagulant medication. Your doctor will monitor your INR levels and adjust your medication as needed. Watch for signs of clot recurrence. While anticoagulant medication can help dissolve blood clots, there is always a risk of recurrence. Watch for signs of recurrent blood clots, such as swelling, redness, or warmth in the affected area. Surgery may be necessary to remove a blood clot in some cases. Here are some tips for safely removing blood clots in the body using surgery. Choose an experienced surgeon. It is important to choose a surgeon who has experience performing the type of surgery you need. Ask your doctor for a referral or do research to find a surgeon with a good reputation. Understand the risks. Like any surgery, there are risks associated with surgery to remove a blood clot. Make sure you understand the potential risks and benefits of the surgery before proceeding. Follow preoperative instructions. Your surgeon will provide you with preoperative instructions, such as avoiding certain medications or fasting before the surgery. Follow these instructions carefully to ensure a safe surgery. Prepare for postoperative care. After the surgery, you will need to take steps to prevent new blood clots from forming. This may include taking anticoagulant medication or wearing compression stockings. Make sure you understand the postoperative care plan before the surgery. Watch for signs of complications. After the surgery, watch for signs of complications, such as bleeding or infection. Contact your doctor immediately if you experience any unusual symptoms. Exercise can help prevent blood clots from forming and may be recommended as part of a treatment plan to safely remove blood clots in the body. Here are some tips for safely removing blood clots using exercise. Consult your doctor. Before starting an exercise routine, it is important to consult your doctor to ensure that it is safe for you. Your doctor may recommend certain types of exercise or activities based on your individual situation. Start slowly. If you have been inactive, it is important to start slowly and gradually increase your activity level. Overdoing it can increase the risk of injury or complications. Focus on low-impact activities. Low-impact activities, such as walking, swimming, or cycling, are usually recommended for individuals with blood clots. High-impact activities, such as running or jumping, can increase the risk of injury or blood clots. Wear compression stockings. Compression stockings can help improve blood flow and reduce the risk of blood clots during exercise. Watch for signs of complications. While exercise can be beneficial for preventing blood clots, it is important to watch for signs of complications, such as swelling or pain. If you experience any unusual symptoms, contact your doctor immediately. Compression stockings are a non-invasive and effective way to prevent and treat blood clots. Here are some tips for safely removing blood clots in the body using compression stockings. Choose the right size and fit. It is important to choose compression stockings that fit properly to ensure maximum effectiveness. Consult with your doctor or a medical professional to determine the appropriate size and fit for you. Wear them as directed. Compression stockings should be worn as directed by your doctor or healthcare provider. Typically, they are worn all day and removed only for showering or bathing. Monitor for skin irritation. Some people may experience skin irritation from wearing compression stockings. If you notice any redness, itching, or other signs of irritation, speak to your doctor. Take them off at night. Compression stockings are usually worn during the day and removed at night. This allows your skin to breathe and reduces the risk of skin irritation. Replace them regularly. Compression stockings lose their effectiveness over time and should be replaced regularly. Follow the manufacturer's recommendations for replacing your compression stockings. Seeking immediate medical attention is crucial for safely removing blood clots in the body. Here are some tips for seeking medical attention. Recognize the signs and symptoms. Blood clots can cause a variety of symptoms, including swelling, pain, redness, warmth, or a feeling of heaviness in the affected area. If you experience any of these symptoms, seek medical attention immediately. Call emergency services. If you experience severe symptoms, such as difficulty breathing, chest pain, or sudden onset of severe pain, call emergency services right away. Go to the emergency room. If you are experiencing symptoms of a blood clot, go to the emergency room immediately. The emergency department will be able to perform diagnostic tests and determine the best course of treatment. Follow your doctor's instructions. Once you have been diagnosed with a blood clot, it is important to follow your doctor's instructions for treatment. This may include taking medication, wearing compression stockings, or undergoing surgery. Watch for signs of complications. Blood clots can lead to serious complications, such as pulmonary embolism or stroke. Watch for signs of complications and seek medical attention immediately if you experience any unusual symptoms.